All right, I think we're going to get started. Looks like we've got a good number of people on. Good morning, everyone. My name is John Donadio. I'm the Executive Director of the New Jersey Association of Counties, and I want to welcome you to our fourth in a series of non-COVID related workshops. This one is on the 988 Suicide Crisis and Lifeline Toolkit. Before we get started with our introductions and the program, though, I want to turn it over to NJAC President and Monmouth County Administrator Terry O'Connor.
Good morning, everyone, and thank you, John. I think that just the sheer volume of attendees that we have with us this morning indicates how significant this issue is to all of us. I know here in Monmouth County in the last year, we lost one of our top law enforcement officials, a senior staff member lost a daughter, and in Southern Monmouth, we have had an epidemic of teens and train incidents related to suicide. So I'm excited today to hear about the program. I really want to thank the Assistant Commissioner for joining us. And I think that, one of the things with COVID, now 2.5 years with us, I think that we're beginning to see, the mental health aspects of the isolation and the fear and the things that everybody lived through. So again, thank you, Assistant Commissioner, for being here with us. And I'm going to turn it back to John so that he can introduce you. Thank you.
Great. Thank you, Madam President. I appreciate it. A couple of housekeeping items before I introduce the Assistant Commissioner, the esteemed Assistant Commissioner. This course has been approved for continuing education credits in CMFO, CCFO, and CPWM. So please see Lauren Wisman in our office, and she'll make sure that you get your credits. And then if you have questions, I know that the Assistant Commissioner is going to leave time for question and answers at the end. Please put them in the Q&A box and not the chat box, as the panelists will be communicating on the Q&A or in the chat box and not the Q&A. So I also want to take a minute to thank Angela Wolf, who does a great job with all of our video conferencing stuff and IT technology. We wouldn't be able to do without her. So thank you, Angela, for, again, doing always a terrific job. And with that, I am very happy to introduce, I'm very pleased to introduce the Assistant Commissioner for the New Jersey Division of Mental Health and Addiction Services in the Department of Human Services, and serves as the single state agency for substance abuse and State Mental Health Authority as designated by the United States Substance Abuse and Mental Health Services Administrations. Valerie Mielke is also the past president of the National, I could be here all day reading her credentials, but I have to get a couple. Past president of the National Association of State Mental Health Program Directors. I think she was president in 2000, from 19 to 21. So as the immediate past president, is a board member of the National Association of State Alcohol and Drug Abuse Directors, and was recently appointed to the National Justice Counts Steering Committee being led by the Council of State and Government Justice Centers. So we are very happy to have and very fortunate to have the Assistant Commissioner here and in New Jersey, and just has always, for as long as I can remember, just been an incredibly valuable resource for the state of New Jersey and for county government. So it's my pleasure to introduce to you Valerie Mielke. Thank you.
Oh, good morning. Okay. Good morning, and thank you so much, Don. That was really kind. And Terry as well. Thank you for the introductions. I am really very happy and pleased to be here to speak with you today about 988. It's an important national initiative that is going on, and certainly is going to help to create greater access for individuals who are experiencing a behavioral health crisis. I want to thank all of you for participating and being here today. And as John said, not only am I pleased to be able to present, but what's most important for me as well is to hear your questions. And since 988 has transitioned, to hear your comments, and if you've heard experiences from others regarding the call lines, if there are opportunities for us to improve what we're doing, I really encourage you to, to put your questions, comments in the chat box so I can review that. This rollout of 988 really is one that needs to be in partnership with all of us together to assure that we are serving individuals to our best abilities. And so I'm happy to present to you what we're doing, but I really look forward to our partnership. So I'm going to share my screen for the slide deck. And then after this meeting, John will make the slides available to all of you as well, so that you'll have this information at your fingertips. Also, I encourage you to reach out to us if even after this presentation you have any questions, concerns, or need any assistance. So it's important to remember that 98 is important because it's an easy to remember number for individuals to call if they're experiencing a psychiatric crisis, if they're in distress, if the individual themselves or their loved ones or a friend, family member is experiencing a psychiatric crisis, talking about feeling hopeless, talking about wanting to hurt themselves, wanting to kill themselves, that 98 is just a much easier number to remember. But I also want to highlight that although, and we'll talk later on in this presentation, although 98, the 3-digit number, became available this past July, it really builds on a current strong infrastructure, particularly here in New Jersey, for individuals to reach out and call a hotline that operates 24 hours a day, 7 days a week, to respond to individuals who are experiencing a psychiatric crisis. And as Terry mentioned, the 988 transition probably couldn't have been more timely, because we're at a time period now where talks about mental health are much more commonplace than they were 3, 5, 10 years ago. And particularly, as individuals worked themselves, through the pandemic, that the trauma of the last 2 years of the pandemic, individuals dealing with loss and fear, during this time period, has also resulted in more individuals experiencing psychiatric crises. So 988 is a new 3-digit dialing code that individuals can use to access suicide prevention and mental health or substance use crisis services, where when individuals call this number, there are trained individuals who answer the phone 24 hours a day, 7 days a week. In addition to calling, individuals can text and chat, can text or chat 988 as well to get in touch with a trained professional to provide support to them and or connect them to services if it's determined that it's necessary. So in terms of preparing for 988, as I mentioned, particularly here in New Jersey, we are really fortunate to have already a strong foundation as it relates to crisis services, crisis response, and the like. However, we developed a coalition of stakeholders. I think it was about 40 stakeholders or so since January of 2021 to help us to prepare for the transition from the 10-digit National Suicide Prevention Lifeline number to 988. Because we knew that with the 3-digit number, that it was much easier for people to remember, and that we expected as a result that more individuals will reach out to access these services. So these coalition members and stakeholders included individuals who have lived experience, in terms of a mental illness, potentially even, having had suicidal ideations in the past. We included law enforcement, and we had representatives from different state departments, like Department of Children and Families, the Office of the Attorney General's office. We had a representative from Division of Developmental Disabilities. We had licensed clinicians. We really looked for a breadth and depth of representatives on our key stakeholder coalition, so that we can get very, very different perspectives of what would be needed for 988 to this transition to be successful. So in terms of the transition to 988, it really did require a bold vision of crisis care system to provide direct life-saving services to those in need. So one of the things I should have mentioned right up front is that 988 is a number that is available across the country. So irrespective of where anyone is in the 50 states and territories as well, that they can call 988 to get access to the Suicide and Crisis Lifeline. So in terms of a bold vision, typically individuals, when they were experiencing a psychiatric crisis, they may have gone to the emergency room, when things got to the point where they could no longer really tolerate, the pain or the helplessness, thoughts of suicide. So they would go to the emergency room, then with the expectation that they would be hospitalized, receive inpatient treatment, and then return back to their communities. What 988 does is it helps to create, helps to strengthen the continuum, the pathways for individuals who are beginning to experience a crisis. That they can call someone 24 hours a day, speak with someone, receive the supports that they need, and remain in their communities. So as I mentioned, New Jersey has a strong acute care crisis response system. We have psychiatric emergency screening services available in every county. In one county, we have three screening centers available. That doesn't exist in every state. In addition to that, our psychiatric emergency services also have a mobile component. And so when there's capacity and have staff available, they will go out and conduct mobile outreaches to individuals in their homes. But in this, with 988, that we are looking to strengthen how individuals access and experience the mental health response. And so I'll talk a little bit more about that. So in 988, nationally, the guiding principles are that the 988 system provides someone to call for individuals who are in crisis, someone to call, someone to respond to them, and somewhere to go. And so in the balance of our this presentation, we really talk within the concept of those guiding principles. So someone to call. So in New Jersey, even prior to the transition of 988 number being available, that we had 5 lifeline centers that answered calls, chats, and text. Those lifeline centers have been an active member of our stakeholder meeting coalitions, and are continuing and have been really enthusiastic about a successful rollout of 988. And so we have we have always had 24/7 access. One of our lifeline centers provides that access. We have always had statewide access for all New Jerseyans. And what we have been doing, what we have been embarking upon is strengthening that the call center, strengthening our call centers with additional resources so that they can further strengthen their infrastructure, hire new staff to be able to respond to additional calls. In addition to that, in New Jersey, one of our other strengths is that we have many other call lines that provide supports to individuals who are experiencing a crisis, including New Jersey 211, Perform Care for children to access children's services through the Children's System of Care. We have peer warm lines such as Cop to Cop, Mom to Mom. We have peer recovery warm lines. All of that is a part of our strength in our infrastructure that that exists here in New Jersey, and that will continue. That continues to exist. In addition to that, we are developing warm transfer protocols of the 988 network so that there's an ability to have bidirectional warm transfers between 911 and 988, Perform Care in 988, New Jersey 211 and 988, and the Division of Developmental Disabilities, as well as some other call lines as well. And so what's the difference between 911 and 988? 911 really is focused on public safety. And where with 911, they dispatch emergency medical services when needed to individuals. It's really it's a rescue response and to stabilize an immediate, where individuals are in immediate danger. 988 is a crisis, provides individuals with access to the Suicide and Crisis Lifeline Network. Through that service, they provide de-escalation services, they provide supports to individuals, as well as linkage to mental health and addiction services. So with the 988, as I mentioned, we do anticipate and have seen an increase in call volume. And as I mentioned, we made funding available to strengthen our call centers. And so 988, the number became available nationally on July 16th of this year. And nationally, they saw a 60% increase in call volume to the National Suicide Prevention Lifeline. Our New Jersey Center saw an increase of approximately 26%. Okay. And so, as I mentioned, in addition to additional funding for the call line themselves, Governor Murphy's Budget Act, which was signed for the state fiscal year 2023, signed in June of this year, includes an increase of $12.8 million to further strengthen our Lifeline centers and infrastructure. Also, $16 million so that we can develop mobile crisis response that can be dispatched from our call centers so that when someone calls in and could benefit from someone responding to them in a location where they are, could be their home or otherwise, that we'll be developing this mobile crisis response. This mobile crisis response will also be available 24 hours a day, 7 days a week. And then also we have, in terms of somewhere to go, we are going to be developing crisis receiving and stabilization centers with resources supported through federal funding. So in terms of the mobile crisis response, we'll go through a competitive process through a request for proposals to award this service across the state. The mobile crisis response teams will include, whenever possible, trained peer specialists, individuals who have lived experience as it relates to mental health. Teams, again, as I mentioned, will go out into the community. They will meet with individuals. They will connect them to services as needed. In almost all scenarios, the mobile crisis response will be without law enforcement. If we assess when someone calls into our call centers that there's an immediate danger but that we want to send out mobile response, in those instances, we will probably continue to send out our psychiatric emergency screening services who go out accompanied with police to make sure that the situation is stable and safe for all involved. In addition to our mobile psychiatric emergency screening and this new mobile response system that we're setting up, we also have children's mobile response, which exists now. It's funded by our Children's System of Care. Then they provide mobile response out to family homes to outreach children, youth, and their families who are in crisis. So that will continue as well. The Crisis Receiving and Stabilization Centers is a service that we hope to have underway and implemented within the next year. And these will be centers that will be operated 24 hours a day, 7 days a week, and staffed by mental health and substance use disorder professionals. And again, whenever possible, we want trained peer specialists, both individuals who have lived experience with in terms of mental illness, as well as individuals who have lived experience as it relates to addictions, to be able to provide supports and connect individuals to treatment. And so we're going to look to locate these centers in various areas across the state. First responders like the police will be able to bring individuals to these centers, as well as individuals will be able to walk in themselves to get supports that they need. And again, this is another piece of our continuum where we are strengthening our system and providing options for individuals, different options for individuals to seek the treatment and services as they deem they need them. So as I mentioned, in New Jersey, we do have a strong existing community service system. And I talked about the designated psychiatric emergency screening centers in every county, available to serve any New Jerseyan. We also have early intervention support services. And I liken this to an urgent care program for individuals who are experiencing a psychiatric crisis. Early intervention support services are currently available in 11 counties. And in the balance of the 10 counties, they are currently in various stages of being implemented. So within the next few months, we will have this psychiatric, what I coin again, urgent care service available in every county. Again, through the support of Governor Murphy and our legislature. The crisis residential services programs. We currently have crisis residential service programs, some that are operated by individuals with lived experience as it relates to mental health, in terms of mental health. We also have crisis residential services that are operated by other, that are not operated necessarily by individuals with experience, but other professionals that are accessed directly from our psychiatric emergency screening centers as a diversion to hospitalization. And so with these crisis residential screening programs, the length of stay vary from 5 days to a month or so. They're voluntary, and it's a place where individuals can experience stabilization of the immediate crisis that they are experiencing, and then they return back to their communities, post, once they are completed with that service. And then we have certified community behavioral health clinics. There are 7 certified community behavioral health clinics that are under contract with the Division of Mental Health and Addiction Services. They serve adults and children who have a mental illness and or substance use disorder. And they provide rapid access to services, behavioral health services. In addition to that, we have a number of additional certified community behavioral health clinics that are under contract directly with the United States Substance Abuse Mental Health Services Administration. So as I mentioned, we have 35 designated psychiatric emergency screening services, plus affiliated screening services in some counties as well that respond to urgent mental health situations and help individuals access psychiatric inpatient treatment, and also have the ability to commit individuals to treatment who they deem are in immediate danger of themselves or others due to their mental illness. I talked about the certified community behavioral health clinics and the crisis residential services. And so some additional facts about 988. So you can access information regarding 988 and the toolkit, information regarding like social media that you can use to share with stakeholders, some messaging that you can use so that, and again, our messaging is in concert and aligned with the messaging that's happening nationally, brochures, wallet cards, and the like, and just information about 988. One of the things that I wanted to mention for informational purposes is that there's an expectation that that when individuals call 988, that those calls will be answered by someone within their state. How those calls go to a central location nationally and then are routed directly to the states. That routing occurs based on the area code of the person's phone. And then the expectation is that that the states are able to respond to those calls locally, so that because they are most familiar with the services in their state. However, there are times when the calls, because of capacity reasons, the calls aren't answered in state. Those calls aren't lost. They bounce to a national, national vendors who are equipped to provide support to individuals and answer those calls. So all calls that come into 988, or if someone calls the 10-digit National Suicide Prevention Lifeline number, are answered. But what we are striving for is that, to the extent possible, those calls are answered in state. So there have been, since the rollout of the 988, the availability of 988 3-digit number, that there has been through social media some disparaging comments made about 988 that are just based in myths and I think also some previous experience that individuals have had as it relates to when they call crisis numbers and the response that it's seeing. And so some of the myths are really grounded in geolocation, that there's a fear that when someone calls 988, that someone automatically is going to get dispatched to that location, including law enforcement. 988, particularly at this point, does not even have geolocation capacity. There's a lot of discussions that's happened. There are discussions that are happening, in Congress and with local advocates as to the pros and cons of geolocation, and tying that to 988. And so I just wanted to make sure that folks understood that at this point in time, that capacity does not even exist. If there's a situation, though, that is life-threatening and that we think that someone is in immediate danger of hurting themselves or others, that the 988 specialist will then transfer the call to 911. They will let the person know this is what they're doing, but only in those instances where it's assessed that that the situation is life-threatening would they transfer that call to 911. In most instances, the experience is that when individuals call the National Suicide Prevention Lifeline, including here in New Jersey, that the crisis is able to be addressed and mitigated through the support provided to the individual through the phone, telephonically. In instances when additional services or supports are needed, that's when an individual may be connected to mobile outreach, or could be connected to the crisis receiving and stabilization centers. Once they're available, individuals can be connected to early intervention support services, that urgent care type program, or certified community behavioral health clinics, or traditional behavioral health services, whether it be for substance use disorder or for behavioral health. So again, 988, a bold vision for crisis care. This is an example of, of a graphic that when you go to the SAMHSA website through the links that I provided, they are making available business cards, I believe posters, and the like that have messaging related to 988 that you can then use to distribute and share with your stakeholders. So again, if you have looking for additional information, please check out our website. Also, the 988 frequently asked questions through SAMHSA. If you want to send a message directly to the Substance Abuse Mental Health Services Administration, you can use that link. Or if you want to reach out to us directly at the Division of Mental Health and Addiction Services, you can use that 988 questions at dhs.nj.gov, and we will respond to you. So again, thank you. And share this. Thank you again so very much for your interest and your attention here today. So I will open it up for questions. I'll take a look at the Q&A. First, out of respect, I'll ask you, John, or Terry, if you have any questions or comments like before I go through the Q&A. Oops, John, you're on mute. I'm sorry.
All right, sorry about that. No, thank you, Valerie. That was terrific, a comprehensive, overview of the program. We will make sure to share the PowerPoint with, all of our county officials and our business associates as well. This is important for them to know about this information. We'll share the frequently asked questions and all other additional resources and point them to the division's or the department's website. I don't know if Terry, I know she had to jump off for a couple of minutes for a call with the director.
I'm still here.
Okay, great. Okay, Terry, so do you have any questions?
No, I think that was really great information. I did see in the Q&A box, John, a couple of good questions.
Yep.
One of them had to do with if you have a child that's at college, because it was, I think you mentioned, Commissioner, about the code for the phone. So if you're out of, if you have a child that's at college, or if somebody's just out of state, how does that work, or out of the area? How would that work?
So what would happen is if the area code is New Jersey area code, but they're out of state, that number would be transferred initially to New Jersey. However, the call lines, because this dynamic existed even prior to 988 rolling out, and so the call centers are trained that if they're able to address the crisis with that individual over the phone and adequately and mitigate the crisis, and the person, both the caller and the call center believe that that no other further that the person is not in danger of hurting themselves or others, or they have existing resources that they can go to provide additional support. Like at college, the colleges, have, counselors and therapists. Certainly it's a requirement here in New Jersey now, but I imagine it's available in other counties, in other colleges as well, that they would refer them back to their state, back to the state. If they think that the person is in immediate danger, there are mechanisms that they can, each state has a contact. For ours, it's the Rutgers emergency call line, that they have a contact person that they can reach out to, and then from there, affect whatever the emergency services that are available to respond to that person. So
thank you for that information.
welcome.
And John, I'm
welcome.
going to
And I want to, I'm sorry, Terry, I don't want to, I'm sorry for interrupting you. I just wanted to highlight as well that, again, the, New Jersey's foundation, and even prior to 98, is a really rich one. Not all states have, an equivalent of like a psychiatric emergency screening service that's available to all, all residents in their state. So the response may look a little different than what it would look like in New Jersey. So I just want to make sure that I highlight that.
Thank you so much for the comprehensive answer. I greatly appreciate it.
Of course, you're welcome.
So Valerie, do you want to read through the questions or do you want me to read them out loud? Whatever's easier for you.
Okay, yeah, I can just run down them. I have them here in front of me.
Okay,
Thank you.
great.
So I
Yep.
can run down them. So how is substance use crisis defined? And what will a mobile response team response for a substance use crisis look like? So in terms of, in responding to this question, I want to back up a little bit. So we want to ensure that no matter how someone however someone may access a service, that once the calls are answered, that people are being routed to the appropriate service. So I say that to say that even in currently, that if someone calls or Reach NJ, which is our 24-hour call line for people to access addiction services, there are times when individuals will call there and they're in a psychiatric crisis, that they will be connected to to mental health services, and there'll be a connection there. Similarly, this will happen with 988. So 988 knows how to access our addiction treatment primarily through using the 24/7 Reach NJ number, and so it's not so important for the caller to think in their heads, is my addiction crisis such that it warrants calling 988? If a person is experiencing a crisis and they don't know where to call, 988 is the number that first comes to their mind. They should call that number, and then they will get connected to the appropriate service. So it's not really incumbent upon the caller to know the right number or to know how it's defined. It's if the caller sees it as a crisis for themselves, then they should just call 988. So hopefully that helped. That fully answered the question. If not, please let me know. If you call 988, are the police contacted? No, absolutely not. And as I mentioned, most calls are handled. Most calls are just handled within that call. That people don't even need additional services. Only if it appears that, and it's from the call center, that the person is in immediate danger of hurting themselves or others, will the call be connected to 911. So the next question, will wallet-sized cards or posters be issued so that you can hand them out to school districts? Yes. So if you reach out to SAMHSA directly to their website, and you can access their website. You can access their website through the link that I provided to you. If you're unable to find it directly, you could reach out to them and order posters, wallet-sized cards, and those kinds of things, and they will distribute them directly to you. They also have graphics that you can use so that if you're creating, your own posters and individualizing it for your entity, for your county, and the like, then you can use their graphics to do that. So considering the current workforce issues, what is the plan for staffing mobile response teams and crisis stabilization centers without pulling critical staff? And so, so we have been looking at just more broadly the staffing challenges. This is certainly a challenge that doesn't just touch New Jersey, but it's a national challenge. We have increased just this year on July 1, we've increased our division contracts, our fee-for-service rates to help to support and enable our agencies to help to support their ability to attract staff and to retain staff. We're continuing to look at other strategies as well to help to strengthen the workforce. And, and we make available training opportunities, like particularly for individuals with lived experience who are interested in working in this field to enable them to provide real meaningful support to individuals who are in crisis. So those are some of the things that we're doing now. The next, do we have any statistics to share in regards to calls received from each county? The call information that I have now is statewide. One of the things that they're looking at nationally is to create a uniform platform that all call centers can use. In New Jersey, all 5 call centers, because they are under contract with us now, when that uniform platform becomes available, we are going to require them to use that uniform platform. And I think through that, there'll be the capacity to really to be able to drill down countywide. But I don't believe we have county specific statistics at this point. Are local hospital crisis centers able to be linked to 988? So our psychiatric emergency screening services, who work directly with the, with our local hospitals, that infrastructure exists currently in terms of their ability to work with, in terms of their ability to connect to psychiatric emergency screening services if they think someone's in immediate danger of hurting themselves or others. So that does continue. They have the telephone numbers for the psychiatric emergency screening services, the 24/7 number, and know how to access that. So that's something that exists. If it is determined that a person in immediate need of a mobile unit during the call, what would the process look like prior to 2023? So right now, if someone is in psychiatric crisis and we believe they may be a danger to themselves or others, our psychiatric emergency screening services, which are tied to hospitals, can go out and are going out now and providing mobile outreach, mobile response. So that continues. What will be strengthened in our system is a much broader ability to have mobile outreach for individuals who may not be who aren't at that threshold of really being in immediate danger to themselves or others. So we're hoping that early in the calendar year 2023, that we will have, we will be in the process of we will be engaged in the procurement process actively for that service. Is there a listing of crisis residential service programs and the certified behavioral health clinics? And how do we learn of the support services available in our counties? So there are a couple of ways this can happen. One is that every county has a county mental health administrator who is a county employee and is a subject matter expert in their county of the services and resources available. Also, in our division, we have a program analyst who is assigned to each and every county. We're also subject matter experts in the counties. And, both of that, the information, you can access our, the Division of Mental Health and Services directly, or go to our website and see who the county directors are. And John, what I can do is I'm gonna write myself a note. What I can do afterwards is I can provide you with the link to the county mental health administrators.
Great, thank you.
And then you can distribute that. Okay. So there are psychiatric emergency screening centers, behavioral health clinics, crisis residential service programs, mobile crisis response, and mobile crisis stabilization centers. There are charter pieces of literature explaining all of these pathways. You know what? I completely appreciate the question, and although the slide deck that I had speaks to each of those services, it is something that we really should develop as a map of sorts of where those services are in each county and who the contacts are. We are in the process right now of updating our website so that it is much more user-friendly and intuitive. It's going to be better. It'll be easier to access some of that information once our website is up and operational. But having an interactive map, I think, would be helpful for that as well. So in the interim, though, certainly, reaching out to our division, we can let you know the services and resources that are available in your counties. And I do have a sheet on our website that captures much of that information now. So I can provide that link to John as well.
So, hey, Valerie, so we have like 5 questions left. And I think that's plenty, and you've been fantastic. But if anyone has any additional questions after the 5 questions, if you don't mind going through, you can send them to us, and we'll make sure to forward them to Valerie, and then we'll get back to you. So why don't we do that? I'll put my email in the chat box if you don't have it. I assume everyone on this call probably does and gets inundated with emails by me on a regular basis. But yeah, so if we can go through these 5 questions, we'll do that. And then any more after that, send them to me, and we'll make sure that we get them to Valerie, if that's okay.
That's perfect. Yes, thank you, John.
Yeah.
So will this number eventually be replacing the 1-800-273, which is the National Suicide Prevention Lifeline number? The answer is no, there aren't any plans for that to happen at this time. What quality assurance will be conducted on call experiences and outcomes? So part of the RFP that we're going to be, the $18 million that I shared with you, is building in a quality insurance piece as well. And because it is absolutely important to know what the caller experiences are, and for us to continue to improve our system of care. So that's going to be an important key. And we're looking at mechanisms to do that. What is the average wait time? As you've been hearing, they're upwards of 2 minutes before you call and speak to a live person. My recollection is that in New Jersey, that nationally, that the call line was nationally, I think the wait line was about 2.5 minutes. But I think in New Jersey, it's less than a half a minute is what I've heard. I don't know if it's increased somewhat with increased call volume that we've seen, but it is they're answered quickly when they're answered here in New Jersey. How many calls are being dropped? And do you think this is due to wait time? I don't have the specific numbers of calls that are being dropped. I think that at times, one of the contributing factors is that, an individual may not have realized the line that they were calling. I think at times it may be because of the wait time. But hopefully, as we continue to strengthen our process, we'll will continue to see a decrease in dropped calls. But the numbers are not very high here in New Jersey. Do you accept volunteers or staff paid professionals? So some of our call centers, some of the 5 call lifeline centers, are operated primarily by volunteers, and for others, they are paid individuals. All need to be trained, but some of them are volunteers, and so it really depends on the call center and the call line that people are engaged with. So that seems to be it. So thank you so much, John.
Yeah, no, thank you. I think that's it. That was fantastic, incredibly helpful. Again, we'll make sure to share the PowerPoint and whatever other resources you'd like us to share. If there's anything that our association can do to help to get the word out, and in any other way that you think would benefit you and the cause here, please let us know. And again, thank you for your time and all the great work that you do, for everyone in the state of New Jersey.
It really is my pleasure and my honor. So thank you so much. And thanks for raising this and providing me with the opportunity, John.
Great. And I hope to see you in person soon.